Another stretching video in 1 week? What? Yeah, no, exactly. I want to talk more about fitness, okay? You get off my back. We're doing a bunch of vitamin breakdowns in the past couple of weeks. So we're going to talk about stretching. Stretching again. Physician shares easy solution to loosening tendons to improve frozen shoulder and other conditions. All right, what is frozen shoulder? Sounds familiar, but maybe it's just different terms for different people. Nowadays, many people use their hands more than their legs on a daily basis. What are you trying to get at? Frozen shoulder, tennis elbow, de Quervain's disease, and trigger finger. Sorry, what? All right. Are all common arm disorders that cause pain and distress. Dr. Guo Bin Wu, director of Xiantiang Chinese Medicine Clinic. Oh, he's going to tell us about tiger eye or walrus tusk, whatever. That could be used to improve the aforementioned conditions, symptoms, and pain. Simple movements to relieve frozen shoulder? Well, tell me more, doc. Frozen shoulder is formerly known as adhesive capsulitis, and its patients are mostly people over the age of 50. Our shoulder joints become more inflamed due to injuries and or poor motion. Yeah, no, nobody who decides to raise their arms above their head, okay? Anybody just goes at best, straight forward, but they never go backwards or anything like that. Nobody Naruto runs anymore. That's just a shame because I like to laugh at spurgs. Some people experience pain when they move their shoulders, and even at some point when they wake up in the middle of the night with a pain and regularly have to sleep disrupted. In traditional Chinese medicine, doctors can use a small needle knife therapy, acupuncture, bloodletting, cupping technique to treat frozen shoulders. Okay, Dr. Wu typically uses acupuncture because the needles are relatively small and leeches are difficult to find. And even if he has a strong stimulation technique, it usually doesn't result in any sequela. After local needling, the adhesion in the shoulder joints can be loosened by stimulation with lifting, thrusting, and twisting techniques to increase the shoulder's movement range. Cool. So there are 4 exercises you can use. So wall climbing, so sitting close to a wall. Oh yeah, and then just moving it up as well, and then just increasing your range of motion. That all makes sense to me. And then just, keep scooching closer to your wall or just your ledge or anything like that. If you can find yourself a situation such as that by just sitting flat-legged or cross-legged on the wall as close as you can get, continue to walk your arm up the wall and then just hold it for whenever you start to feel a little bit of pressure right there. Hold it 20 to 30 seconds and continue to walk it up as well. So that's what I would recommend there. A chest expansion exercise. Yeah, no, exactly. I can kind of do that with my door back there. Keep it in proper line. Okay, don't be moving too far up. Don't be moving too far down. Make sure that your elbow, your wrist, and your shoulder are in proper line. Put your hand, I'm going to turn it into a bicep and a chest stretch at the same time, so that you put your hand flat on the wall behind you and then you can just twist a little bit, and then you'll feel maybe a little bit of relief in your posterior, the back head of your delt, because there's 3 heads of your delt. Okay, posterior on the back side, medial on the outside. That gives you the nice rounded boulder appearance of a shoulder. Okay, and then your anterior on the front. That's the boy that sticks out if you're doing chest exercises poorly. Again, if you put a flat hand on the wall, you can even walk, but then it'd be totally out of frame so that you get yourself closer to the wall as well. And then you start to feel more of a pull on your chest and then even into your bicep as well. So you can get all of it at the same time. Or if you want to get specifically close to a wall, anything like that, yeah, you can just throw up the old or I guess that would be what, left turn? Or rather right turn if you're doing hand signals for vehicles. Towel pulling. Oh yeah, no, exactly. If you can't link your hands, okay, I'll show you a little magic trick. If you can't get away with doing that, well, you can just put a towel there and then you can just start to pull backwards and forwards, and then you can also do it with the other side as well. It's tough to do if you don't have the flexibility like that, but you can work your way up to it. I know some people who can only go, as far as maybe to the back of their neck and then maybe to the middle of their spine. Okay. if given enough time and if you're flexible enough, you'll eventually start to have said flexibility. It's not an impossibility, okay? It's not even a it's not even a probability. It's a likelihood if you just stick to it. And then an arm exercise. Okay, yeah, so doing half arm circles. That would help as well. I totally understand, because you want to be using the full range of motion when it comes to your shoulder as well, okay? Unlike the neck, when you're doing neck circles or anything like that, you don't want to look specifically backwards, because that puts a lot of undue stress on your windpipe and then on your spine as well. You don't want any compression that's there. But when it comes to your shoulders and hips, yeah, man, feel free. Work circles for until the day is long. So what about tennis elbow? Interesting. Most common condition in the elbow joint is lateral epicondylitis. Okay, whenever you see, here's just a little tip for everybody that's out there. A lot of these muscular terminologies, okay, are just biological descriptors. Whenever you see is or tis at the end of something, that refers to inflammation. Okay, that's just an old carryover from Latin terminology as well. So the more you know, that means inflammation. So your lateral epicondyle, it's experiencing inflammation. So how do you work on that? All the extensor muscles in the forearm are attached to the lateral epicondyle. That's the term, okay, of the humerus through the tendons. Okay, that's the little gimmicks at the bottom of your humerus. That's where the origins of those are. Okay, so that'd be the little jut out point. You can feel the little divot in your arm just below your elbow. Okay, that's where everything all attaches. Don't press too hard on that. That hurts. Some people choose for pain relief injections, but you could just stretch and avoid the needles and do it for free at your home. Move 2 finger breadths from the pain spot and pluck the tendon like a guitar string, but don't pluck the pain spot directly. Yeah, no, exactly. You can just do a little bit of massaging as well. So yeah, you can feel where it is because it's, you know, right there. But then, yeah, you can also do a little bit of digging in there as well. If it's a little bit tight, you know, it might make you a little weak to your knees. So feel free to do that when you're sitting down. Actually, that feels really good. So I'm going to continue to do that until we read the next one. Tendon loosening method for quick pain relief to de Quervain's tenosynovitis, whatever. All right. Don't come after me for that. That's a long word. Tenosynovitis. Dr. Wu once treated a patient who was a new mother. Aw, how adorable. How was the kid? Since she was so afraid of dropping her baby, she would hold her baby with her wrists hooked inward. Tough. That's interesting. So what, she walked around like a crab with her kid? Just constantly framing her bosom. After exerting the wrong type of force on a prolonged period of time, she developed her de Quervain's tenosynovitis. My mistake. Jeez. The inflammation, see, I didn't just make that up, of the tendon sheaths at the styloid process of the radius and the painful condition. So it looks like, yeah, you're just massaging from the inside, okay, from the lateral side of your forearm all the way up until you get right to your wrist, the little divot there. Very interesting. For acupuncture points for self-treatment of wrist pain. Okay, so both sides of the interior dent of your elbow, and then right just above, okay, so up towards the tricep, okay, so in between the two heads of your tricep when you're just doing a straightforward elbow, okay, yeah, so right there when you can feel the indentation in between two of the three heads of the tricep, obviously, and then yeah, your two inside points there, you can press them and massage them, and then there's one 3 finger widths down from your wrist as well. Interesting, very interesting. Kind of medial line of your forearm, okay, on the outside. Very interesting. Last but not least, the trigger finger. Okay, stenosing tenosynovitis is usually caused by the overuse of the finger, which causes the tendons and ligaments at the base of the finger to rub repeatedly, thus eventually leading to inflammation. Use the tip of your thumb to gently stroke the tendons near the painful spots at the base of your right thumb. Oh, okay. Find approximately 10 of those pain points and stroke up and down at once every point. Okay, and then do it slower, and then faster, then slower again. Just kidding. Stroking the painful spot 3 to 4 times a day will help loosen the tendons and the affected area. Very cool, man. Method is very simple, but it must be consistent. The effects show after 1 to 2 weeks, and that is carryover for literally everything in there. And that's one thing about stretching. As long as you're consistent, you're going to see progress. You're not going to see progress overnight, okay? You might be impressed day to day. It's like, oh gosh, I could only get so close to the wall. But then the next day, you might be able to get a half step closer. And then after that, you're right up against the wall. Hopefully like that. Not like a map or anything, but just, hey, you're stretching, you're using the wall. Hey, maybe you were once needing a chair to do your stretches, but then you've also developed enough balance in order to not need the chair. And then, hey man, like every other form of exercise, little incremental improvements just mean the world. Okay. So with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.